ये बहुत ही अच्छा इवेंट था। मैंने इसमें हिस्सा लेकर बहुत कुछ सीखा। और जब बात होती है ब्रेस्ट कैंसर की तो सबसे ज़्यादा इम्पोर्टेंट बात है अवेयरनेस, अर्ली डिटेक्शन। और जाइडस ने एक बहुत ही ब्यूटीफुल इनिशिएटिव लॉन्च किया है, अवेयरनेस कैंपेन लॉन्च किया है, कॉल्ड द ईजीएस्ट एग्ज़ाम। तो इट वाज ऑल अ पार्ट ऑफ टुडेज प्रोसीडिंग्स। और यहाँ आकर मुझे बहुत अच्छा लगा एंड आई रियली एंजॉयड मॉडरेटिंग द पैनल एज वेल।
Thoughts on Zydus breast cancer campaign and what do you think it will have the potential impact of such a campaign?
So, as you heard on the dais, that what has happened currently is when we talk that in India only 1 in 28 patients, women, are diagnosed with breast cancer. The world rate is 1 in 8. Now the question we need to ask ourselves is it really 1 in 28 in India, or are we missing those women who get diagnosed at stage 4, stage 3, or are the resources not there? So I am very thankful to Zydus for coming up with this campaign where every single woman with resources, without resources, can just, as per her menstrual cycle, every month check for the changes in her body and report and raise an alarm if need be, and we can save so many women, because 90,000 women to lose in a single year is not a small number. We need more women in this society, and we are raised and loved and cared for by women. So thank you, Zydus, for this wonderful campaign, and I hope it reaches as many females as it can. I hope more males take it to the females in their households. And
What the panelists said, that counseling is very important. And to start with, how to make the patient be open for counseling, create awareness. And these kind of programs are really initiating awareness for breast cancer, and that makes it easy, the path easy for an oncopsychotherapist, that is myself. And I would like to say that what is being a fad now of precision medicine, psychotherapy for counseling. We are practicing since last 10 years in our center, that is NK Dhaba Cancer Foundation. On Care is running a program for patients doing art therapy, music, dance therapy. Dr. Khurshid is managing in that. I think you can...
Yeah, so once again, coming back to the importance of early diagnosis, it's absolutely important. As part of our campaign, we travel into rural areas with, trying to detect breast cancer, especially at a very early stage. We have different methods of diagnosing. Of course, your self-breast exam is the best, but one step more, like with technology, is we have the iBreast machines. We have different techniques now for early detection, which can then be followed up by mammography and other techniques. And post that, like a lot of people said, the denial, and to convince the people to kind of come out, take the treatment, which is very, very, affordable and doable now, is very important. Because even after seeing a lump or after feeling a lump, the scare and the social stigma prevents ladies from coming up and taking the right treatment.
Yeah.
So I am Dr. Khurshid Mistry, part of NK Dabar Cancer Foundation, and running the palliative and supportive care center called OnCare. And
And I'm Dr. Paru Daba. I'm an oncopsychotherapist.
Shruti Arora, medical oncologist and hemato-oncologist at Nanavati Max, consultant, and at Empire Bandra.
Ma'am, tell us about the initiative taken by Zydus, and what
I
is your view on that, and how much is it important to take the initiative to aware the people?
So I think Zydus has taken it is a very important initiative which Zydus is taking, because now also we see a lot of patients coming to us very late, people not talking about this, people not being aware that a painless lump can actually be something so severe in later life. And I think so it is a very good initiative to talk about. The more you talk about things, the more awareness that you spread, and it not only spoke about patient awareness but what the caregivers go through. So it was quite a holistic approach. Apart from treatment, taking the psychological support of the patients, other financial supports of the patient, getting innovation in it. So I think so Zydus is doing a fantastic job.
Good evening. I am Dr. Shyam Agrawal. I am a medical oncologist and director of Navodaya Cancer Hospital. Today I am very enthralled to see this event because it is very close to my heart. I am working in oncology since last 25 years, but this is the event which really touched me. We lose so many women just because of simple small lump in the breast. But it is so aggressive because they say breast cancer is the systemic disease right from its inception. And people neglect it. They say it's a very simple small lump, how can it kill me? But definitely it metastasizes so fast that it can go to the lungs and livers and brains, and we have a devastated death of the lady. And the good news is we have very good treatment. We have targeted treatment, we have ADCs, we have immunotherapy, and we have early diagnosis by PET scan, mammography, and all what they have. So definitely I message all the women to do breast examination every year, as the easiest examination has been pushed off. And then if anything is abnormal, then definitely go to your doctor and get it checked. Don't delay, because delay can kill you. Thank you. The most important one is the thickening of the breast skin, or there is a lump.
I'm Dr. Ganpati Bhatt, medical oncologist from Jastok Hospital, Mumbai. So for the female, that the awareness of the breast cancer is important, and the healthy lifestyle, weight reduction, and those who are having the already family health risk factors, they should have the checkup earlier. And modification of the lifestyle is very important, and reducing the weight and the healthy lifestyle adoption is very important in breast cancer.
I'm a cancer specialist practicing since more than 25 years. Breast self-examination is the most important and the simple thing which all women at all ages should start. Whatever anyone says, from the age, once the breast is developed, the lady should know their own breast, and any change from the difference like forming a lump, a nipple retraction, or a mass in the axilla, one should go to the doctor immediately.
Hi, I am Dr. Prasad Narayanan. I am the Director of Medical Oncology at Sidecare Hospitals in Bangalore. Yeah, this is the very right time for a breast cancer campaign. This is the Breast Cancer Awareness Month. So Zydus is focusing on early breast cancer detection, and the focus is on self-breast examination. I think that is a very important campaign, and we know that there is 16% is the incidence of breast cancer in India now, and it is the most common cancer among women. So I congratulate Zydus for this initiative, and it's a very important initiative. A 3-minute self-breast examination can help in detecting breast cancers early, which is a very significant thing for our country.
So I think it's a very excellent initiative. The stories of hope, always when patients come to us, when a doctor tells them something, it's always different. And when a patient, somebody who's actually gone through the entire procedure, talks to them, it's always a different experience. So definitely, reading about all these stories where women have survived the disease and come out, it's going to be inspirational for all the patients, and definitely launching this book is going to create a lot of awareness.
Yeah, so a lot of challenges, definitely, but if your mind has to be really strong. Once your mind is strong and you accept it, first acceptance is very, very important. Once you accept it, everything is easier. Including that, your family support is also very important. Once you have a good family support and good doctors and your mind is set, then definitely it is easier. So I urge all of you to have a very good family support.
The campaign addresses something really important, that is being self-aware, being aware that there could be something wrong with you and identifying about it in the very early stages. So identification and knowledge is the first step. So if you're not aware and you don't have the right information, I don't think the right procedures and medical treatments can be done and taken forward.
So family history is a very important part of breast cancer. But mind you, not all cases are family history related. So out of 100 cases of breast cancer, maybe 10 are related to family history. In that, also significant family history, that is if you have more than 2 relatives, first or second degree, if they are positive for breast or ovarian cancer, then you need to be worried. So consult your oncologist and your doctor to know the chances and the risks of your family history.